Miranda. Hi all at FIA, this is student Nick Blackwell, number 150149094. I'm here to do a screening today with Roger, one of our new clients. Essentially, Roger, we're going to be here today to perform a postural and dynamic appraisal.
Yep, sounds good.
Great. On top of that, we will have a series of girth measurements to do at different anatomical sites on your body, as well as basic body composition measurements, so height and weight.
Yep.
To finish off the session, we'll do a food diary and what I would best describe as a mental brainstorming session regarding your fitness journey to take you forward.
Sure.
So looking at motivation and kind of outlining goals and that kind of thing.
Yep, no worries.
Perfect. To start things off, I think we'll go with the simplest and easiest, height and weight.
Yep.
If you wouldn't mind stepping up to the tape we have behind you, we'll
Alright.
just grab a brick to take our measurement. And it would indicate that you're 179 centimetres tall.
Yay.
Sound about right?
Yeah. Yep.
Perfect. On top of that, I'll just get you to step on the scales just off to our
yeah.
right here. They should light up and let you know. 78.4.
Ah,
Sound right?
yeah, pretty close.
Yeah, perfect. If you want to mind just coming up and taking a seat at the table here. With these measurements in mind, we can produce what's called a body mass index.
Yep.
You've heard of that before?
Yep.
Yeah. So essentially, what a BMI is, it's an indication of your overall, I guess, health in a very, very general aspect. It won't tell us anything like fat distribution or how much fat your body's made up of.
Mm.
But as the most basic guide, it gives us an indication of what a healthy weight should be for a person of each kind of height.
Yeah.
So taking your height of 179,
Yep.
and your weight of 78.4,
Yep.
we can punch this into a calculator here. And so if we take your weight, divide it by your height squared,
Yep.
in meters. Sorry, I'm just having issues with the calculator here.
Mm.
That's better. Sorry about that, that took quite a while. Gives us a BMI of 24.46.
Yep. And is that any good?
Look, it is on the higher end of things, but it's not absolutely indicative because you do look like quite a fit, healthy young man.
Mm.
Our typical
Young.
I'm trying to pass the compliment. No, very good. You're still in normal weight range. However, it does theoretically become overweight at 24.99, 25 threshold.
Okay. Well,
However, looking at you now, you don't seem anywhere near that regard.
Yeah.
And so that's why I say it's the most general representation of health. For example, muscle weighs more than fat.
Yep.
And so you could have an individual who's extremely muscular, be declared overweight or even obese, according to a BMI. And so that's where its flaws start to come out when you start talking about fat versus muscle percentage versus bone density versus bone percentage, water. It's a whole plethora of factors that contribute to it. But for our most guiding principle, that's what we have here.
Yeah.
Would you just mind entering in your name, age, gender, and date of birth?
all right.
Perfect. And so with that, just your age and date of birth. Please.
Alright.
Thank you.
Date of birth is there.
Aye.
Age. Yeah.
Perfect. I can deal with the rest later from here.
Alright.
So next we're kind of stepping it up a little bit in terms of the complexity. We're looking at a set of girth measurements.
Yep.
And so as you can see in this sheet here, we'll be taking them from your chest, waist, arms, hips and thigh.
Yep.
And so the chest, it'll be at the widest point of the bust. The waist, it'll be pretty much around your belly button. That'll be kind of the landmark we're looking for. We're looking for something that we can repeat again and again and again. So your belly button's a great landmark to use.
Yep.
Your hips, often we take a number of measurements at the hips, but we look for the widest place we can find on the hips and then do essentially a tape measure above, tape measure width above that initial measurement and one below, and that gives us an average that we can work with.
Sure.
That'll contribute to our waist-hip ratio, which is another one of these very broad guiding principles of health at the moment for the population.
Sure.
And I'll get into that in a moment. Your arm, we'll take a measurement that's equidistance between two processes, one in your elbow and one in your shoulder, and essentially that's a point that we can recreate again and again and again and again. It gives us a sense of continuity and a repeatable nature of this measurement.
Yep.
So if you want to step into the light here, we can get started with this. And so, I'll ask you to pass this end around yourself.
Yep.
Lovely. Take a hold of that if you're happy with that.
Yep.
Lovely. So, that point there, we have a bust right on 100, which is a nice easy number for me to remember.
Mm-hmm.
Perfect. Get you to repeat the same again, this time right over your belly button if you don't mind. Perfect. From there, we can cinch it in just a little bit. There we go. And we have it at 89. From here, I might just let it drop a little bit and we'll take it down to your hips.
Yep.
So down to the widest part. So it will be sitting around the widest part of your glute as well.
Yep.
So that's 93. We'll actually drop it a little bit. So it's actually sitting on your glutes a bit.
Yep.
That's kind of where we take our measurement more. That's a bit better. So now we have one of 101.
Yep.
Just let it reel down a little bit and take a lower measurement. 100, and bring it back up again. That one's of 99, so gives us pretty much dead on 100.
Yep. Bit of a square block.
Yeah, and it's typical of
100 at the hip, 100 at the chest.
yes, and then 89 in the middle. So I mean that's very typical of men to do that actually. Women more so you'll see greater significance. They will have obviously typically wider hips.
Yeah.
With waists similar size, maybe a touch narrower. If you don't mind now, I'm just going to make a mark on the side of your arm.
Yep.
We'll go with just your left arm for the sake of things.
My left arm.
Sorry, right arm just for the sake of light.
Yeah.
I'm rolling this up. So just between, just going to make a mark between these two prostheses. Yeah, so we can always remeasure at that point. Uh, 30 centimeters. Last but not least, I'm going to ask you to stand with your feet just shoulder width apart.
Yep.
Nice, and let your hands just drop to your sides. Nice. And so where your middle finger meets your thigh, I'm going to place the tape around your thigh.
Yep.
And that'll be a landmark that we can recreate again and again, but it's just for your thigh girth measurement. The tape's just going to come around your knee here. Have you at 49. Let me just do that properly. Got you a centimetre there, 50.
150.
150.
150.
If you wouldn't mind coming back up to the table, we can talk about your waist hip ratio.
Sure.
And so, as I mentioned, it's another, I guess, very broad guiding principle that we use in the fitness industry to help us kind of not determine, but get an indication of someone's health.
Yep.
And so it's as simple as dividing your waist circumference by your hip. For men, anything over a ratio of 0.9,
Yep.
we consider them to be at risk.
Yep.
And so you are at 0.89.
Yep.
So right under what we would consider at risk. So
Yep.
we'll take that any kind of the day of the week. It's quite a safe assumption.
Yep.
And so nothing wrong there at all.
No, good.
And now we get on to another fun part of our, I guess, screening today, which is our postural appraisal. So the first one, it's a little bit strange, and some people find it a little bit strange in the fact that I'm going to ask you to essentially stand in what you would consider your everyday posture.
Yep.
And I'm just going to be essentially making some observations of your posture, anything that stands out and that kind of thing. We can discuss that after.
Yep.
But I'll just have a look, and if there's anything that stands out, we'll talk about it and that kind of thing, and how it may impact you this way and the other.
Yep.
I'll get you to essentially take 4 different stances. So front on, facing left, facing right, behind.
Yep.
And it just gives us an all-encompassing view of your posture at that point. So if you wouldn't mind taking a stance in the light, I'm going to ask you to do something really strange. Yeah, I will. First off, just facing me. What I'm going to get you to do is march like a tin man 5 times on the spot. So just like this. And just let your body come to a rest after. Perfect. So I don't want you to tense up now, but I don't want you to move either, okay? Lots of people kind of feel the need to move after we start talking about their posture. But as long as you can maintain that, that's all good for us.
Yep.
And so I'm just going to kind of talk about what I'm seeing with you right now. Starting at the top, it's good to see your head is nice and level. There doesn't appear to be any rotation or tilt, which is great to see. You're moving down, your neck's nice and straight at that point. Looking at your shoulders, there's definitely a bit of, I guess, imbalance or asymmetry there. Your right hand side, yeah, sits a lot lower. So essentially, I don't know what to say. Normally it's the left hand side that we would talk about at this point in time. Potentially you've got a little bit of tightness in your upper trapezius leading to an elevated kind of shoulder at this point. But essentially it will take a little bit of time to deduce this and see what happens. Breaking down your body, I'm looking at your elbows there. Your left hand side sits proportionately higher to your right hand side if we compare that to the height of your shoulders, so no real surprises there. Your hands are nice. Essentially they're sitting in a nice neutral position. They're not knuckles forward or knuckles to the side or backwards. Essentially that just indicates nice, I guess, natural posturing at this point. There's nothing wrong there. There's no tightness in the chest or the back at this point that would kind of lead those to rotate. In terms of your overall balance, looking at your nose, what would be the depression in your sternum down the middle, you seem to have even weight balance, which is great to see. The only thing that I can notice there is a slight discrepancy, probably is the best word here, between how your arms sit against your body. Your left hand side appears to be a little bit straighter and sits out from your body a little bit with a little bit less anterior rotation. Aside from that, your arches, can't quite tell from the socks, but your arches seem fine. Your feet are sitting pretty nice and neutrally. I'm just going to have a quick look at what would be called your ASIS, and so that's a part of your pelvis. I'm going to find 2 landmarks there, and hopefully they're nice and level, and that'll give us a nice indication of how you are, I guess, supporting the rest of your upper body on your pelvis.
Yep.
So if you don't mind, there we are. So we have our 2 points right here and here, and they're pretty much perfectly sitting in your waistband and are really nice and level. I can't see anything too noticeable out of that, which is great to see. Having a nice level pelvis is a great base of support. It also kind of means that everything below it should be in pretty good working order as well. It's kind of like a tabletop in the sense that if it's out of whack, it often means that there's something else out of whack amongst the legs.
Yep.
So speaking of that, I'm just going to quickly come down here. Are you able to straighten both your legs for me? Yeah. Okay. So I'm just going to try and find the tops of your patellas if you don't mind. As long as they're at the same height, it's a really... Look, they're incredibly close, and there's no real bowing of your knees or knock kneededness, no, so I'm not concerned there at all, which is really nice to see. Aside from that, I think we're really good and ready to turn to our next position.
Yep.
So 90 degrees of your choosing, and again I'm just going to get you to do 5 marching steps. Perfect, and just let everything come to rest. Lovely. So again I'm just going to start at the top, and so looking at your head and neck, it sits a little bit further forward than I would imagine. You have, I guess, what we would call military neck. It's a little bit of a jargon term, but it means that your head and neck sit slightly forward of where they would be expected to with ideal posture. Looking, as I work my way down, I'm just going to have a look at your shoulders, and they appear to be, well, at least on this side anyway, a little bit rotated forward. So it would kind of indicate, if you, come over here and show you, it would indicate potentially a tighter chest. And so that could be something that we address in the future. You don't need to change your posture, it's just whatever feels natural. But aside from that, if I look at your hip, knee and ankle, that line there is all quite good, quite strong. And so essentially that would lead me to believe that you're probably going to have pretty good spinal alignment. And so if you don't mind, I'm just going to run my fingers down your back. And just try and gauge that curve, which there should be what's called a kyphotic curve here, which I can notice, which is great, and it should transition to a curve going the opposite way, a lordotic curve. And with that and the shape that your shirt's forming against your body, I can see that you've got a nice amount of both there, which is great to see. Beyond that, there's not too much going on. Your hips, I'm just going to have a look at them in a minute. But firstly, I want to take a look at your scapula, because I just noticed something there, that you appear to have a bit of scapular winging, which is essentially, if I go right here, you can feel my fingers kind of reaching under there a little bit. And it just means that either typically the rhomboid, you've got a couple muscles in your back that are not as strong as they should be, or potentially, again, often due to a tight chest, it'll bring everything forward and out. Now, as I was saying, I'll just get on to the your hips, if you don't mind. We just talked about the ASIS. There's one more location on your body called PSIS, and it's at the rear of your body. If you don't mind, I'm just going to have a feel around there and try and find them both and have a look at them. Again, this is for a little bit of pelvic alignment. So if you want to bring this arm up to 90 degrees, oh no, a 90 degree bend if you want. Yep, that's it. So I found both there, and there's about a centimetre of discrepancy between the two, which is perfectly normal. That's exactly what we want to see. And it kind of means that you have what would be defined as a natural pelvic tilt. You haven't got what would be called anterior pelvic tilt or posterior pelvic tilt. Both of those lead to kind of loading problems with your back and legs.
Yep.
So that's great to see. And again, I'm just looking at your legs there. It appears that you can straighten one leg better than the other. Have you've had surgery on your knees, I assume?
I have had, surgery on both knees actually.
Both knees, righto. Yeah.
One's had meniscus damage removed and has no PCL.
Yep.
And the other one's had an ACL replacement.
Yeah.
With meniscus damage.
Well, that's quite extensive. Righto. Well, I'm going to get you to rotate 90 degrees again, so this time you should be facing the wall. And if you wouldn't mind marching on the spot again, that would be great, just to reset your stance. Your shirt might not be doing you any favours here because it's sitting a little bit lopsided, but again we're seeing this shoulders definitely a bit higher than the other, and there seems to be a little bit of muscle mass missing here as if I'm to compare it with your other one, which is quite well informed. But if we go back to the top, I'm looking here. Are you looking dead straight ahead there, Roger?
Yep, I think
Yeah.
so.
Okay. Seems to be a tiny little bit of head rotation, a touch towards your left-hand side, but definitely nothing extraordinary. Yeah, as I noted, that left-hand shoulder is definitely sitting a bit higher. If you don't mind, I'm going to have a little bit more of a feel around that scapula just while I'm got the look. I did see obviously the winging here and here in the chest, but aside from that, their rotation and inferior angles seem to be quite normal. While I'm here, I'm just going to run my finger down your back. What we're looking for is what is called scoliosis, and essentially it's imperfections in the path of the spine. Ideally, it's perfectly straight, aside from the kyphotic and lordotic curve I mentioned earlier. So my finger's just going to come down here, and I'm just going to try and feel each vertebrae. All seems pretty well there, Roger.
Cool.
It all makes one nice complete straight line, which is great to see. There's no irregular curvature.
Yep.
While we're working our way down, we talked about the PSIS a moment ago. Just like we did with the ASIS, we're going to look for lateral stability and how level it is. So if you don't mind, I'm just about to come down behind here and feel for your PSIS and just check how level they are. Yeah, and those points are just dead level, which is great to see. So no complaints there at all. I'm just working my way down here, Roger, and it's great to see that overall your centre of mass seems to be running straight down your body.
Yep.
So your weight distribution is great. Again, with your knees, the surgery would probably be a major contributor to it, but one leg being straighter than the other. And aside from that, your foot placement seems quite natural. So it's all good to see. And so with that, I'm just going to ask you to make one more 90-degree turn, and this will be the final one, and march on the spot for us if you wouldn't mind. Perfect. So I think we've covered most of the stuff before. I would say this shoulder is actually a bit better than the other one. It's not so forward, it hasn't got so much forward rotation than we mentioned previously. There is still a little bit, but far less, and that kind of creates a better plumb line between your ear, which is still slightly forward, but the rear of your ear does transverse the center of your shoulder, your hip, slightly anterior but centered portion of your knee, and just in front of your center of ankle, which is great to see. That's a good kind of balanced position. From here, I'll just check any kind of discrepancy in your PSIS and ASIS, as we've already covered most of the stuff regarding the curvature of your spine.
Yep.
And after that, we will be moving on to our movement analysis. So if you wouldn't mind lifting in elbow up to 90 degrees, that's it. And yeah, I think it's the pretty same story. Like, it's about maybe a centimetre, maybe less, in terms of the discrepancy, but that's exactly what we want to see, a slightly higher PSIS than we do our ASIS.
Yep.
And so definitely can't complain there. you wouldn't mind moving forward onto the mat.
No worries.
So this here is our movement analysis.
Yep.
So what I'm going to get you to do are 3 different actions. The first one is an overhead squat. It'll look something like this if you want to just take a step back for a second. What I'm going to get you to do is rest the bar on your head and have your arms at 90 degrees. So that when you raise the bar up to do straight overhead, your arms are at this preset angle determined by your body.
Yep. That's good.
From there, we're going to try and keep ourselves as straight as possible and descend down into the squat. Pardon me. Just like that.
Yep.
And so, essentially, I'll get you to do it a couple times. I'm going to take a look from each kind of different viewpoint.
Yep.
And make kind of some assumptions and observations on how you track through
Sure.
that. We don't want to overwork ourselves here. We just want to go down as far as we can and as safely as we can, if you don't mind. So starting at 90 degrees, I need your arms to come out just a little bit. So this arm is come out there. Perfect. And you raise it up. Nice. Yep. And when you're ready to go down. Okay. Oop. Be careful there. We don't want you to hurt yourself there, Roger. Try and keep your heels on the ground. That's better.
That better? Like
Yeah, that was better than the first one. Your heels came off the first time. Yep. Try and keep the heels on the ground. That's it. Good.
Yeah.
Can I get 2 more? Nice. Alright. That'll be enough. So, the first thing I noticed, Roger, was when you racked the bar, so to speak, on your head,
Yeah.
your shoulders sat unevenly as we kind of expected. They're already elevated.
Mm-hmm.
But your left shoulder needed a fair bit of support from your right to get the bar up to the point that you couldn't lift the bar at the same time.
Yeah. That'll be because of the surgery on that shoulder.
Right.
Yeah.
Can you kind of detail what surgery you had at that point?
So it's been dislocated twice.
Yeah.
And the second time, while the first time supposedly the supraspinatus was damaged and
Yeah.
then I didn't get it repaired, and then the second time they looked in at the shoulder
Yeah.
and the supraspinatus was gone.
Yeah.
And then there needed to be some sewing up of infraspinatus and
Yep.
the other muscles that are associated with the
Right.
Yep.
Yeah. So it's not just atrophy. It's not just atrophy there, but an entire muscle rupturing, so to speak.
Well, it's the tendon is snapped in half,
Yeah.
and so the muscle just shrinks away to nothing.
Yes.
Because it's no longer.
Yes, but it wasn't anchored either.
No.
No.
Okay.
Aside from that, it wasn't too bad. You seem to have a little bit of missing ankle mobility,
Mm.
and so that was kind of why you were coming up on your heels in the interim and
Yep.
potentially finding it quite difficult to squat.
Mm.
You kind of forced that, which was a little great to see, but it did result in a little bit of twisting as you kind of transferred way down, and
Oh yeah.
potentially that's a little bit to do with some hip or knee mobility
Yep.
that we might have to address.
Mm. I've had ankle surgeries as well.
You've had ankle surgeries as well, right? That may
I
contribute to a lack of mobility.
Reconstruction on my left one. And
Yep. Anything in your hips?
No.
While I'm at it?
No.
No? Because for the most part, your trunk and spinal posture was quite good. You held a
Mhm.
nice straight line. There wasn't any kind of hunching and that kind of thing when you forced yourself to stand upright. That was great to see.
Yeah.
Aside from actually transitioning from the racked to lifted position, your arms and shoulders, your elbows, wrists and shoulders tracked in a nice straight line, which was good to see.
Yeah.
There wasn't any kind of deviation that way. Yeah, it was just the rotation into your squat.
Mm-hmm.
So I am going to try and explore this shoulder a little bit more, if you don't mind,
Mm-hmm.
which brings us to our second movement. Thank you. We're going to go back into a lower rack position.
Yeah.
Where we're going to rack the bar on our shoulders. Well, actually, sorry, we'll start with it racked on our head at 90 degrees.
Yeah.
We're going to bring it down to our chest.
Yeah.
And we're going to start an overhead press.
Oh yeah.
And I want you to remain nice and stable and just go through the motions. Hopefully this bar isn't too much weight and you can just push through the motions smoothly.
Yep.
So I want to see that your elbows and wrists track in a nice straight line vertically.
Yep.
So if you wouldn't mind racking the bar over your head, yeah, at 90. So this hand here has just got to come out a touch. There you go. That's enough. And now bring it down to your chest if you don't mind. And now, if you wouldn't mind pressing up. Yeah, so there is. You're not tiring there, Roger?
Oh, not too bad.
I'm just quite curious at the moment, 'cause there is quite a sizable difference in the pathway between your arms here.
Mm.
That'll be enough. So with the shoulder that's been operated on our left hand one here,
Yeah.
it's a bit more of a pendulum motion as you
Mm.
push up and over. The right one's got a better strict form, goes up and down this way.
Yeah.
Your right hand one's got a bit of a swinging pendulum motion to it.
Yeah.
And so that can definitely be attributed to the surgery and everything that's come out of that you've picked a different pathway using different muscles to the ones that were operated on.
Yeah, well, the one that's not there, so there's no supraspinatus.
Yeah.
You've just got to find another way to do what.
Exactly.
Yeah.
Right on it. Yeah, so with that in mind, we're going to give it a chance to test a different pathway.
Mm.
We're going to get you to do some push-ups.
Oh yeah.
Here, I can take that if you like. And they're going to be pretty strict form push-ups.
Yep.
So we're going to do them through our knees just so we can do a decent volume of them.
Yep.
So if you're looking at what I do right now, if you just stay there, I'll just show you a couple of
Oh, yeah.
results. Knees are up together, hands facing forward.
Yep.
Just shoulder width to just over shoulder width.
Yep.
And when we come down, our arms
yep.
aren't pressed right against our body, so it causes problems. It's just a little bit out,
Yep.
but they are quite tight.
Yep.
We have a nice straight back. Your feet can either be on the ground or in the air, whatever takes your preference.
Yep.
But we have a good core, and we're pushing up nice and straight.
Yep.
Whenever you're ready. Yeah, so that's miles different, Roger. Nice. Alright, that'll be plenty, Roger. And that's really great to see that when it's locked into that position there on the
Yeah.
ground, and in that movement there, your shoulders have almost identical pathways.
Yeah. Yeah.
So your scapular adduction is almost identical.
Yeah.
There's no winging of one or the other. There's no rising or elevation of the shoulders at that point. Both your shoulders can abduct, and your arms are locking out at an even pace, and so you're holding a nice, even, posture, a push-up posture, so to speak. You haven't got one side falling or the other.
Yep.
So, all in all, that's actually quite great to see.
Yeah. Good.
From here, we get into a bit of the, less fitnessy orientated stuff, but more the stuff that makes everything else happen.
Yeah. Sure.
We're going to work our way through a food diary for the day,
Yeah. Yep.
and some kind of goals and that kind of thing.
Yeah. Sure. Sounds good.
Perfect. If you want to take a seat at the table. So we get to the part of the examination, I guess, regarding your behaviour change, and I think we'll start with this one, kind of your attitude towards this fitness journey and kind of what you want to get out of it. And so I guess the best way to start is where we want to be in, say, let's 6 months.
Oh, yeah. I guess I'd like to do some more gym work.
Yep.
Do enough of other stuff, I think.
Yep.
And maybe just work into some sort of maintenance type of program that and then start to build up from there.
So
just
looking
get used
after
to it.
yourself and that
Yeah.
kind of thing.
Yep, and getting the joints used to lifting weights again and
Yeah. Well, hopefully by 6 months they're well and truly used to it. Is there anything in particular like size or weight or?
I think I could be stronger around the shoulder.
Yeah.
That's got concern. So that
Yeah.
would be, like a chest area and bicep area and tricep area and trying to build that a bit.
Yeah, nice. Well, we did actually do those girth measurements today we talked about. I think maybe a great way to monitor your progression with that would be to potentially remeasure those girth measurements at certain increments. And so potentially we could say by the 6 month mark that we've added 5 to 10 centimetres to your chest.
Yep.
And maybe 3 to 5 centimetres to your bicep.
Yeah, sure.
Yeah,
Yep.
no, perfect. I'll just add that one down here, just make a quick note of it.
Yep.
And so with that in mind, we've got our long-term goal. We kind of have to work back now, and being new to the gym yourself,
Well, I haven't been to the gym for a while.
Yeah.
Yeah.
Were you a regular user of the gym? Were you?
No, I haven't ever I've never had a gym membership. I've just used whatever I've had at home
Right.
or have been to the university gym. But,
Yeah. How do you go with routine?
Routine, depending on workload.
Yeah.
Depends on workload.
Yeah, because obviously often the biggest thing with gym is establishing a routine, having, I guess they say consistency is key. It's a cliche for a reason, isn't it?
Yeah.
But establishing a gym routine is often a great goal for someone to have as either returning to the gym from a long spell away or entering it for the first time. So I think for yourself, setting that as a goal, attending every session for the first 10 weeks is a great thing, and try and set your mind to that. So that's the goal I would advise as to yourself as a new gym member.
I'd have to then maybe reduce off my bike riding and other things because I don't have a lot of time in my day. But I'd have to wind that back a bit then.
Well, it also, and we say gym time. I think we talk about gym and training as kind of the one and the same thing.
Okay.
Maybe the bike ride is what you need that day, as opposed to being in the gym, just to keep your desire to train up. And so I think it is a responsibility of both of us, but it's my role as a trainer to make training desirable to you and engaging to you, so that this short-term goal doesn't become a chore, that you want to train each and every day.
Yep.
And so I think we'll just say to form a gym attendance routine is probably a good short-term goal.
Yep. That is a challenge, no doubt about that. Work does get in the way sometimes.
And so we've got our stepping stone goal now, between the short term, which is very it's very much about how you conduct yourself, to whether our long term goal is purely results based. What's going to be our stepping stone in between there? What's going to, I guess, get us from A, just attending the gym, to B, seeing the results in the gym?
Yeah, no, I think I guess I need to develop better movement patterns and,
Yep.
and flexibility and get used again on I guess the right ways in which to lift the weights and that sort of thing. I've got that knowledge for a while and
Yeah.
so to build those up and develop those, I guess.
Right. So kind of increase your mobility and neuromuscular patterns,
yeah.
or
Yep.
we could almost even say rebuild.
Yeah, that'll be a rebuild, I reckon. And making sure that there's good form and that the movement is correct and that it's safe, I guess.
Well, that's my job as well, to make sure that you are, I guess, lifting in the safest way possible. It's my job to teach you how to lift safely and how to lift correctly, so that even if you did part from the gym in terms of private training, you would still be able to conduct yourself in a safe manner in the gym, because that's what we want for everyone at the end of the day.
Yeah, for sure.
With that, I might hand the controls over to you for this short questionnaire.
Yeah, for sure.
There are 12